A dangerous wildfire exploded.
Heavy rain forced the river right through the...
Powerful new storms are happening in the southern plains.
Thousands remain without power after more than 30 tornadoes touched down Tuesday.
People have died after a 7.2 magnitude earthquake hit.
Rescue and recovery efforts continue in remote areas to
Nurses
save
and doctors
lives.
have left for Haiti, bringing with them lots of medical supplies to help the sick and injured.
I've always been interested in helping the needy, and that's why I went into medicine many years ago. In 1997, I received a letter from a former pastor who at that time was a missionary in Dominican Republic. He told me that he was very upset about the lack of health care and witnessing all the death and illnesses of the people, and asked me if I would consider coming down there and evaluating the health care system. Over the course of 2 weeks, we were able to see approximately 3,000 people, and we immunized about 2,000 children that never had any previous health care. I founded Medical Missionaries because of the great need that I experienced in dealing with the undeveloped world. One of the things we learned on the very first trip is, as bad as the healthcare was in the Dominican Republic, it was 100 times worse in Haiti. The Haitian side of the equation was approximately 125 to 150,000 people with no health care, nothing. And it's an overwhelming objective to all of a sudden walk in and you have patients everywhere all the time. We decided we would want to build some type of facility that could be there all the time and be a 24/7 healthcare facility. It took us 10 years to raise the money with the help of the KOC to build the clinic, which sees approximately 25,000 people a year. It delivers approximately 50, 60 babies per month. And the whole system has been the biggest employer of Haitians in the Tomasik area. The need of the people is overwhelming, and that's the main reason why we have stuck with this over the years. It is a challenge, and it still is, and it will always be. Charity is reaching out to the needy, giving of one's time and talents, fortune, to those in need. And that can take on many shapes and forms, and it has in Medical Missionaries. The Knights were crucial with this project. They were very supportive in a number of ways. The financial way, with funds for construction. Secondly, many of the Knights participated by helping with the construction of the clinic. The Knights of Columbus was founded on the principles of blatant charity, and we're doing the same thing from a little different angle. The unique thing about our work is that I've always relied on them. They're sustainable, they're there, and they're not going to say, oh no, impossible, no. We both approach a problem from the standpoint not by how many ways to deny the problem or not do it. We don't give up.
While we have a large number of charities that we support on a regular basis, Medical Missionaries is always up there at the top because we know the value of the work that the Medical Missionaries do for people who are really in need.
The whole partnership is a partnership of hope. And this is very important because now we have built a very big hospital, and thanks be to God, we're equipping the hospital, practically all the beds. This is how much hope has come from the containers.
I always use the cliche when we get involved in a trip or a project or whatnot, we're on a wing and a prayer. So I pray all the time to myself, to others, to other people that work with us. Faith has been the standard, and I've tried to do as best I can. I don't think anything that I've done is extraordinary, but I do think that I do this for the people. That's where the need is, and that's where the effort should be made. The real need is for the people out there who are suffering. We are and will remain a charitable organization forever, and good Lord willing, we'll continue to move forward.